Good afternoon, everyone. Premier John Horgan here on the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nation. I'm joined here today for the regular briefing of Dr. Henry and Minister Dix to update on the state of COVID cases and a history of how we got here and what the vaccine program has been able to do for us to this point in time. I'm also very excited to advise yesterday we have lowered the age for vaccinations to 12. So 12 to 17-year-olds are now available to register, to get a booking, and get a vaccination. That's good news for families who will want to do this together as we increase our immunity in households, in communities right across the province. This is an exciting time for us as we see case counts coming down, the burden on our hospitals lessening somewhat, and some light at the end of the tunnel. But I'm here today on a normal day for Dr. Henry and Minister Dix to talk directly to you to reinforce that there are public health orders in place. There are travel restrictions in place, not to the beginning of the long weekend, but to the end of the long weekend. As a province, we've come a great distance over the past 15 months. Families, businesses, communities, individuals have struggled through this pandemic, and we have a little ways to go yet. But we're so close. I urge all British Columbians to recognize that we do have public health orders in place until Monday evening at midnight. Tuesday, next week, Minister Dix, Dr. Henry and I will be back again to talk about our restart plan. We're all excited about a positive summer and a hopeful fall, but we got to get there. We have to get there. And that means adhering to the restrictions that are in place today, tomorrow, and throughout the weekend. I'm confident that British Columbians can make this modest sacrifice for one more long weekend so we can protect our frontline workers who have been there for us for the past 15 months and well before that, keeping us safe when we most need it. They need us right now to follow the orders so that we can have the summer that we all want to see. I'm excited about the vaccination program and the success we've had. Dr. Henry is going to lay out some very important information that will highlight for all of us the importance of registering, getting a booking, and getting a vaccination. British Columbians from age 12 and up are accessible to this system. We have clinics in communities around British Columbia. It's easy, it's simple, and it'll keep you and your family and your community safe. So with that, I'll ask Dr. Henry to take the microphone, and I look forward to the briefing.
Thank you very much and good afternoon. We'll start off with an update on our cases here in British Columbia today. Today we have 357 new cases diagnosed with COVID-19, bringing the total number of people with COVID-19 to 140,953 in British Columbia. 80 of the new cases live in the Vancouver Coastal Health Region, 210 in the Fraser Health Region, 12 are people in the Vancouver Island Health Region, 33 people live in Interior Health, and 22 in the Northern Health Region. We currently have 4,636 active cases across the province, 331 of whom are in hospital, 113 in critical care or ICU, and 134,521 people have recovered from their acute illness. Sadly, we continue to have people who die from COVID-19, and today we have 3 more of our family members, our friends, our colleagues who have passed away from COVID-19. One in Northern Health, a person in their 70s, a person again in a long-term care home in Interior Health in their 90s, and 2 people in Fraser Health in their 60s and 80s. And our condolences go out to the family members, the care providers, and our communities who mourn all of the 1,661 people we have lost this year. We have 1 new outbreak to report, the Chartwell Carleton Care Home in Fraser Health, and outbreaks are now over at the Dawson Creek and Region Hospital and at Orchard Haven Long-Term Care. So this leaves us with 4 active outbreaks in long-term care and assisted living and 1 in acute care. It has reporting of outbreaks in assisted living and long-term care homes has been included in our daily reports from the very beginning of this pandemic, and the information is now summarized, as you know, in public health reports that come out weekly. The information is provided by the leaders in each of our health authority to the BC CDC, and that forms our weekly outbreak report. It has come to my attention in the past week that there are several outbreaks in assisted living that were responded to over the past number of months and were managed and aggressively, as we do for all outbreaks, but have not been reported or posted in our outbreak reports. Two are in the Vancouver Coastal Health Region, one at the Terraces on 7th and one at the Chalmers Long-Term Care Home. Full action was taken by local public health and by my public health colleagues to manage with those facilities, but they have not yet been included. And so recently, as we became aware of this, we want to make sure that all of these outbreaks are in our outbreak reports, and they will be added today for transparency. And going forward, we will make sure that we include all of these outbreaks in our reports and the weekly outbreak reports. So the exciting news today that we continue to have growth in our immunization program, and we've delivered 2,687,360 doses of all three of our COVID-19 vaccines in BC. And that's a little over 58% of adults 18 and over in British Columbia, and about 3% or 138,906 have been second doses. I'd like to share a little bit of information about what that means for us. And this is an infographic that shows what we call vaccine effectiveness. And this is aligned with what we shared last Thursday when we talked about breakthrough and the risk of infection going down when people are immunized. What this looks at is those people in our community who are 70 years of age and over, who received a single dose of Pfizer vaccine mostly. How effective does that mean at a community level of preventing transmission of infections? And this is done using a very rigorous process led by Dr. Danuta Skowronski at the BC CDC, where we have done this for many other respiratory pathogens, including influenza. And we're now at the point where we can assess the effect that our immunization program is having in our community here in BC. And what it shows us is that our vaccine program is highly effective. After 3 to 4 weeks, so 21 to 28 days, with a single dose, our risk in our community of transmitting SARS-CoV has been reduced by 70%. This means we prevent over 2 of 3 infections, new infections. This tells us really important things, along with the information we presented last week, that when we have this level of protection at a community level, our rates of transmission go down, our rates of severe illness go down, and that protects our hospital system and protects each one of us. It tells us our vaccines work, but it also reminds us that it takes time for these vaccines to do what they need to do to stimulate our immune system and for that full protection to come. And that means we need to continue to pay attention to our full safety measures for the coming weeks as we bridge to that new future that we have in the summer. As more and more of us are being immunized, this level of protection will spread in our communities. And importantly, today, everyone in BC, as the Premier has said, who is 12 and older, can now register and book your vaccine. Appointments are being booked for about 310,000 youth, aged 12 to 17, and all of them are eligible for the Pfizer vaccine. Currently, it is only the Pfizer vaccine that's licensed for use in children, or has a notice of compliance, as we call it, for youth down to age 12. We are expecting that the Moderna vaccine, they have been doing trials in younger people around with that vaccine, and we're hopeful that it will, very soon, also be approved for use. But currently, it's the Pfizer vaccine, and young people will be welcomed into all of the clinics that we have around the province, whether it's our large immunization sites in some cases, in some more rural or remote communities. It might be the clinic set up for your whole of community immunization. In some cases, it will be in schools, but we have consulted with public health, with our youth groups and families, and we found that the most effective way for youth to be immunized and for families to go together is to do it through our clinics that we have established around the province. We will, like those 18 plus, we do encourage all youth to register online by phone at our Services BC Centre. And if you don't have a personal health number, then register by phone. You can book an appointment yourself if you're a young person in this category, or you can have a parent, guardian, or trusted adult work with you to do that. If a parent or guardian has an appointment booked already, you can bring the youth that 12 to 17 with you to that appointment. And that's one thing that we're going to do at all of our clinics so that families can come together and get vaccinated at the same time. If you plan to do this, it helps if you register, but that's not required. Or you can, but when you do arrive at the clinic, let people know so that we can have a special stream to make sure that we're able to get you through efficiently. We've been working with the Youth Vaccination Advisory Committee from the BC Children's Hospital to make sure that we have youth-friendly clinics available and we can answer the questions that young people have about these vaccines and about their concerns. But please come together. We'll be having after-school clinics. There'll be clinics through this weekend that people will be eligible for. When you go to your appointments, please bring your ID for everyone getting vaccinated, and that could be a BC Services card, your school identification card, birth certificate, or a bank card, and ideally have your personal health number with you or available. It's an exciting step for all of us, and we know that youth are excited not only because it's important to protect themselves, but because they know that it's important to protect their families and their loved ones. And really, I hear from youth is to get their lives back so that we can get to that new future where we're able to socialize again and spend time together with those that we love. Just like we have seen countless people celebrating their vaccine with photos to friends and family on social media, we look forward to seeing young adults joining our team of millions of people now in British Columbia who are doing their part. And I know there's a number of young people in my life who are booked already, and I'm looking forward to seeing their pictures soon. We know that many young people have been negatively impacted by COVID-19 and by the pandemic and by the measures that we've had to put in place now. Now you too will have the opportunity to get vaccinated, to get protected, and to protect those around you. I know it has been tough, but there is a light ahead and it's coming soon. I'd like to remind everybody, though, that our public health and travel restrictions are still in place until end of this long weekend. And the vaccine effectiveness, the information we've presented on how we are managing and the pandemic and the situation we're in right now reinforces we need to stay the course. Now is not the time to let up as we're doing so well and getting so far ahead. This means we all need to stay local, stay small, and continue to use all of our layers of protection. I want to ensure all of the positive momentum that we have gained in these last weeks through the sacrifices, small and great, that all of us have made are going to get us safely to this next part of our pandemic journey. Getting vaccinated is how we'll be able to put the COVID-19 pandemic behind us and make sure that even though this virus is going to be with us for some time, we can manage that without putting the strain on our families and our communities that we have now. We're making incredible progress by registering, booking, getting immunized, staying small, and staying local. We are all one step closer to the end of this pandemic. I wish everybody a happy and safe long weekend and remind you that no matter where you may be or what you may be doing, now is our time to continue to be kind, to be calm, and to be safe. Thank you.
Thank you very much, Premier. Thank you very much, Dr. Henry. I wanted to start by passing on my condolences, those of the Premier, the government, everyone in BC, to the families, friends, and caregivers of the 3 people who have passed away in the last 24 hours linked to COVID-19 in BC. it continues to be this long into the pandemic a difficult time for many people, an impossible time to come together and grieve in the way that they need to. And so we want to let those families know, those friends, communities, caregivers know that we grieve with them today, and we are thinking about them every day. I wanted to just note that we've seen, as you know, with respect to hospitalizations, some decline in the level of hospitalizations from a high of 511 in hospital and 183 in critical care to 331 in hospital today and 113 in critical care. And while that situation is an obvious improvement, we continue to face challenges. For example, we're still using surge beds in our healthcare system. We have a lot of available base and surge beds across the system, 3,035 overall in hospitals and 298 vacant base and surge beds overall. But we're still using 13 in critical care, 13 surge beds in critical care, and 167 throughout our hospital system. And this tells us there continues to be real pressure in our hospital system and something to reflect on every day. And we want to thank everyone working in healthcare, from healthcare assistants to healthcare workers to health sciences professionals, nurses, doctors, pharmacists, everyone who's involved in immunization, but particularly in acute care in this challenging time, for their continued work in this area. I want to let all of you know, because there's a lot of interest in this, that the BC CDC's interactive dashboard with vaccination coverage, test positivity, and case rates for CHSA, that's Community Health Service Area, and LHA, Local Health Area level data, is now ready to launch this afternoon, and it will be launching and live on the BC CDC website before 4:30 today. Every Thursday, we bring you up to date on the surgical renewal commitment. As you know, Tuesday, May 18th, a year ago, we resumed surgeries after the first wave of COVID-19. We've had many achievements since then, and these are outlined in our weekly and monthly surgical renewal progress reports. And as noted, right now we are beginning to see hospitalizations decrease, but our hospitalization rate remains significantly higher than it was in the first wave of the pandemic. We are continuing to support our healthcare staff by postponing non-urgent surgeries in two of our major health authorities, Fraser Health and Vancouver Coastal Health. The number of surgeries postponed May 10th to 16th was 360. That's 162 in Fraser Health and 198 in Vancouver Coastal Health. No surgeries were postponed in Interior Health, Island Health, Northern Health Authority, or the Provincial Health Services Authority. So from the period April 19th to May 16th, a total of 1,843 surgeries have been postponed. Just as we bring you up to date, we should note that we have completed very significant surgeries. For example, in the week of May 3rd to 9th, health authorities completed 7,015 surgeries, of which 5,569 were scheduled and 1,445 were unscheduled surgeries. And that is a significant achievement in a pandemic. To have done that, 7,000 surgeries, is not far from what we do normally. It reflects the changes we've made, but it also reflects the extraordinary work we've done in our system. But these changes and these limits on the number of surgeries we do continue, and it should send a message, given how strongly I feel, and doctors and nurses and health sciences professionals and health authorities and the premiers and Dr. Henry feel about the need to continue to work together to bring down transmission in BC this weekend, that we are not making changes as of today in what we're doing in acute care. It's an important message to everyone that we need to stay the course, especially during this long weekend. I want to say just finally that we continue to register a very significant number of people. As you know, about 59% of all eligible adults now have been immunized, 54.9% of all eligible people, which is now 12 and above, have been immunized, and 2,765,082 people have registered. You recall when the Premier launched our efforts to boost registrations a couple of weeks ago, that number was 2 million. So we've seen a significant increase. My message this weekend is register, 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 and then book, book, book. Whether you're 14 or 44 or 84, if you haven't registered, registered. If you haven't booked, book. And if we do that, we can continue to make progress in the COVID-19 pandemic. I wanted to say finally en français qu'aujourd'hui, nous annonçons 357 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 140 953 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19, pour un total de 1661 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 331 personnes sont actuellement hospitalisées, dont 113 en soins intensifs. Merci beaucoup. Thank you very much. I'm going to return the podium to the Premier, and we're happy to take your questions.